Welcome. We're glad you're here, and we appreciate the chance to tell you about your best choice for joint replacement surgery. As you're about to see, the outpatient program here at the Surgical Center of Greensboro isn't just exceptional, it's revolutionary. Through our skill, experience, and state-of-the-art equipment, our process lets you go home the same day or the next morning instead of the typical 2 to 3 day hospital stay. So if you're ready for joint replacement surgery, this is where you should be.
On behalf of the surgeons and the team here at the Surgical Center of Greensboro, I want to welcome you. I also want to make sure that you're comfortable and confident that you've chosen this place for your total joint replacement as an outpatient surgery.
Over the next few minutes, we'll show you what to expect start to finish as an outpatient, and you'll see how the Surgical Center of Greensboro offers you a faster, easier return to a normal life that's better than ever. Here in one comprehensive center, our orthopedic surgeons work together to deliver the best possible joint replacement procedures, care, and outcomes. Our staff, nurses, and support team are committed to providing the absolute best surgical care in a compassionate and respectful manner. There's no substitute for skill and experience, and our group of surgeons ranks in the top 10 in the country in numbers of total and partial joint replacements done annually. You're truly in good hands here. In addition to our short stay protocols, the Surgical Center of Greensboro has pioneered North Carolina's first bundled payment program for outpatient joint replacement. This means your doctor, your insurance program, and your surgery center all work together to create an optimal experience. By choosing the Surgical Center of Greensboro, you're part of a program that's physician-led, patient-focused, and takes each patient through the entire duration of recovery care, typically 90 days. You'll love the fact that you can safely return home sooner, not later. Where most joint replacement surgeries require a 2 to 3 day hospital stay, here you're discharged the same day as surgery. Why is that so important? Because there's no place like home. You're not sick. You don't need to be in a hospital. We'll provide all the guidance you'll need to care for yourself and heal faster in your home environment. That's the big picture. Now let's look at the actual patient experience and cover some important things you'll need to know. Prior to being scheduled for your procedure here at the Surgical Center, 2 things need to be addressed. First, you'll need to have your blood work done. This will be ordered in your orthopedic surgeon's office. Second, you'll need to be cleared for surgery by your primary medical doctor or your cardiologist if you have one. This may require a visit in person, but if they've seen you recently and all your medical conditions are stable, they can just sign the clearance form and fax it to your orthopedic surgeon's office. Once cleared, your joint replacement surgery will be scheduled by your orthopedic surgeon's office staff. They'll create a personalized plan of care that includes all your pre-op, surgical, and post-op appointments, plus all your physical therapy appointments. And most important, they'll tell you exactly when to arrive here at the Surgical Center for your surgery.
After you and your surgeon have reached a decision for outpatient joint replacement, you will be assigned a case manager. She will get you entered into the outpatient joint program. She will fill out paperwork to get you into the joint registry, which tracks your outcomes. She will give you what times to be at the surgery center and also when to get your preoperative labs done. After the surgery, she will contact you on the day you go home and then weekly thereafter to make sure that you are doing well. If you have any problems or issues after surgery, you will be able to contact her via email, text message, or often via phone.
The first item on your new schedule will be a history and physical appointment at your surgeon's office. This takes place about 2 weeks prior to surgery. You'll meet with your surgeon's case manager to go over your personalized plan of care and make sure everything is set for surgery. You'll also meet with the physician assistant to make sure everything's in order regarding your medications and to make sure you understand the surgical procedure ahead. This is an excellent time to bring a list of questions to ask. We want you heading into surgery confident that everyone is on the same page and that you're fully up to speed on what will take place on the day of surgery and over the next 3 months. The week prior to surgery, an anesthesia nurse will call you to go over some questions that help assess your anesthesia needs for surgery. They'll already have your medical information, your doctor's medical clearance, and your lab work. But if there are any significant medical issues they feel need to be addressed, you may be asked to go see the anesthesiologist in person. Part of our short duration outpatient program is to be sure you have all the tools needed at home to decrease pain and swelling and maximize your range of motion. Depending on which joint you're having replaced, you'll receive certain items or equipment to assist in your post-operative care. These range from ice wraps to a walker to a continuous passive motion machine for knee therapy. Some of this equipment may be delivered before your procedure, and some will be given to you following surgery at the center. We want you to be well prepared at home when you return after surgery, so we'll help you think ahead about things like grocery shopping and laundry. You'll also want to remove any rugs, furniture, or obstacles you could trip on. And if you opt to receive them, we'll send you text reminders in the days leading up to your surgery to remind you about all these important preoperative steps. We highly recommend you choose to receive these texts to assure you're on track and on schedule. The day of your surgery is a very special one because it's the start of a life that's easier, more active, and much more comfortable. Once you arrive at the surgery center, you'll be prepped for surgery by one of our pre-op nurses. Be sure to come in dressed in loose clothing that you can also wear on your trip home. Once you change into a surgical gown, your belongings will be given to your companion for safekeeping. Here in the pre-op room, the nurse will start an IV and go over some basic paperwork with you. He or she will also ask you to mark the site of the surgery. Then the anesthesiologist and surgeon will come in to speak with you. The surgeon will also mark the site. If a pain block is called for, it will be given in this pre-op room. Blocks are standard for knee joint replacement. Your surgery will take between 1 and 2 hours, then you'll be moved to the recovery room. If you're discharged to go home on the day of surgery, you and your loved ones will be trained on how to safely navigate to the bathroom as well as up and down stairs. During this time, it is critical to stay ahead of your pain and communicate with the nurses about how you're feeling.
Yeah, one of the hallmarks for success in an outpatient arthroplasty program is standardization of protocols for preoperative care, surgical care during the operation itself, and then most importantly for post-operative care and recovery. Our goal is to mobilize the patients as quickly as possible and to do this in a manner that is standardized. So we came up with fairly strict protocols in order to allow for early mobilization to foster an early recovery for our patients. Generally, with our knee and hip replacements patients, once their spinal anesthesia is worn off, we'll have them up walking immediately and even have them doing stairs on the day of surgery. We feel it's really important for early mobilization to enhance recovery and to prevent blood clots and other complications associated with immobility. Our goal was to get the patients home as soon as they're comfortable and safe as far as their mobility. Once they get home, we enhance the recovery by getting them involved in physical therapy early. With our early results, our first 100 patients or so, we found that these standardized protocols have really led to fantastic results and very high satisfaction levels for both the patients and the surgeons involved in the program.
It's very likely you'll be discharged the same day you're admitted, possibly as soon as 6 hours after your surgery. Your nurses will go over discharge instructions with you. Even when you're safely back home, we'll be keeping a close eye on your post-operative care. Your outpatient therapy will take place at one of our partnering physical therapy locations. These therapists have been carefully selected by your surgeon. They'll be following specific orders regarding number of visits, number of weeks, and types of exercises to speed your recovery. Remember that all these and all your appointments will be clearly laid out in the plan of care guide that was created for you when your surgery was first scheduled. In 10 to 14 days after your surgery, it'll be time for your first post-op appointment with your surgeon. Your wound will be checked, x-rays will be taken, and if staples were used, they will be removed. This important meeting will include discussion of pain management and your physical therapy progress. Please be sure to bring your patient education folder as well as your physical therapy progress note, pain medication bottles, and a list of any questions for your doctor. Over the 90 days after surgery, you'll be scheduled for 1 or 2 additional post-op visits. Just check your plan of care for dates and times. We consider good communication to be a vital part of every joint replacement experience. If you have questions prior to or after your surgery, please call your surgeon's office during business hours. After hours, there will always be a doctor on call, but it's best to talk with a surgeon who's familiar with your case. No question is a dumb question, and we encourage you to ask anything that's on your mind. Our goal is for you to be completely educated, informed, and comfortable with the entire process. Emergencies following surgery are very rare, and most issues can be resolved with a phone call or a visit to our office. A trip to the emergency room should be avoided unless you have a true emergency and you've talked with us before you go. At the Surgical Center of Greensboro, we want to make your joint replacement journey a great one. Our team of doctors, nurses, and staff is here to provide the best care possible before, during, and after your surgery. Our goal is to deliver a world-class experience for you, and we're grateful to be able to participate in your care. Remember, your personal plan of care is the key to a smooth process over the 90-day period from surgery to recovery. And feel free to replay this video to review the tips and steps that will help you have the best outcome from our revolutionary surgery program. Thank you for watching, and thanks for choosing the Surgical Center of Greensboro. We look forward to the day you walk into our office pain-free.